Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hey everybody, Dr. Mark Sims here. I'm the host of the Listen Up podcast, where I feature top leaders in hearing healthcare. This episode is brought to you by Listen Up Hearing Center. I help patients to effectively treat their hearing loss so that they can connect better with their friends and family and remain independent. The reason I'm so passionate about hearing loss is because I lost my brother Robbie twice. First, to hearing loss from radiation to his brain tumor, and then when he passed away. I only care for ears. I'm the E of ENT. I've performed over 10,000 ear surgeries and taken care of many more people with hearing loss. I'm the founder of Listen Up Hearing Centers, and I've also written a book by the same name, Listen Up, A Physician's Guide to Effectively Treating Your Hearing Loss. If you want to learn more about that, go to listenuphearing.com. That's listenuphearing.com. Today, we have a great guest. It's Dr. Kelly Breese. She's a board-certified audiologist. She's fluent in American Sign Language and specializes in the treatment of hearing loss and tinnitus. She suffered from debilitating tinnitus and empathizes with the difficulties many of her patients face. In the warm-up, she also mentioned she's a veterinarian audiologist, and we'll talk about that as well. She practices at Doc Side Audiology and Hearing Aids of Sarasota. She earned her doctorate degree just down the road from us at University of Arizona and received her bachelor's degree cum laude in communication sciences and disorders and a minor in music performance from the University of Florida. We're excited to have her on the podcast. Welcome to Listen Up. Thanks for coming on, Kelly.
Thanks for having me, Mark.
So, Kelly, tell me how you got into into the hearing loss, tinnitus, and audiology space. What was what brought you here?
Yeah, life kind of came full circle for me. So, growing up, I competitively and professionally performed as a percussionist since the age of 9. I was third in the nation at 13 in percussion performance. I've been in what is it called? Bands of America, where you have to compete to be able to take place to being part of bands. So percussion music has been a huge part of my life. But going into grad school, I knew that necessarily wouldn't make me money being a musician. I love it, love it, love it. But I also knew I loved helping people and healthcare, but blood was not for me. So what happened is I took a course and the sign language professor came on in and was signing and had a cochlear implant. And I was like, this is really interesting. This another kind of, I feel music is a language. American Sign Language is an actual language. Many people think it's not, but it is. And so I started taking American Sign Language. And in doing so, I started becoming a qualified interpreter. So I did a lot of interpreting. But my professor really pulled me over to the side of audiology for a few reasons. One, he did not get his implant. He was born deaf. His family couldn't really communicate with him until the age of about 22 when he finally got his cochlear implant. And so learning about the deaf community, deaf culture, and wanting to be an audiologist that is there not to fix them, to kind of bridge that gap, knowing that there are resources for them. That's not an audiologist saying they have to have a cochlear implant. That was one big advocate for me. And the other thing was when I was still practicing music at Florida, we had to do a project, and I found a woman named Evelyn Glennie, and she started losing her hearing when she was young, and she's a percussionist as well. So she is very well known, fantastic percussionist, but she started feeling sound through her body by being barefoot. So kind of all this stuff just blended together, and I'm like, oh my gosh, audiology is the way for me.
That's awesome. Do you still perform in percussion?
I wish. I've done everything from orchestras, jazz bands, bar bands, all that stuff. But grad school got me busy. And then now being a business owner and a single mom has me a little busy, but hoping to add that back in soon.
No, it's hard. I mean,
it is.
Music is a consumptive thing especially to do it at such a high level that you're describing. And so you've traveled far. You told me you did some of your training in Arizona, some in Colorado, and then came back home to Florida. So tell me a little bit about your practice and what you do and what type of patients you tend to take care of.
Yeah, so I started my practice November 2020, which is kind of crazy in the middle of COVID. I have one practice in Sarasota.
What did you know, right? I mean,
I didn't know. I was like, no, here we go. But a gentleman was retiring with very similar mindset of mine with how I wanted patients to be treated. So now 2.5 years in, I have 3 locations, an additional one on Longboat Key, and then a third one in Sun City Center, where I used to work up there and my patients wanted me back. They found me and said, come on back. So once my non-compete was up, I added a third location. So I do anything and everything from hearing tests, tinnitus consultations, evaluations, management of tinnitus, love earwax removal. I can test dogs and horses hearing. I can do newborn hearing screenings, repairs of hearing aids, all that jazz. So I love it all. I'm working on adding some dizziness stuff into my regimen, but it's more so history and how they can follow up therapy-wise.
Okay, great. And so in terms of your practice, is there any area you see more of? Is it hearing loss, tinnitus, both?
Leading right now is tinnitus. I'm certified in tinnitus management, and I'm a big advocate for educating the community. So in doing a lot of seminars and doing some publications, people are finally realizing that there are things we can do to help alleviate it. It's just everyone usually says, all right, you can't do anything. You just got to live with it. And then they're just on their way. There's no resources except Dr. Google, which isn't always the greatest resource. So I'm seeing more and more tinnitus patients for sure, but a lot of hearing loss as well.
Yeah, I think that's that comment, there's nothing I can do about it. I think that's actually a two-sided comment. So what I would say is I think some of our colleagues will say, you just live with it. And, frankly, many people do just live with it. It's a benign process that they live with. But having counseled some patients with tinnitus and going over many, many different things that they can do for tinnitus, they'll look at me and they'll say, so what you're saying is there's nothing I can do about it. And so I would say that sentiment also comes from, and what I'll say to them is, well, actually what you're saying to me is I've told you a bunch of things you can do about it and you don't like any of them as the answer, which is a little bit different than there's nothing I can do.
Absolutely. Right? Absolutely.
I actually think it's on both sides of the proverbial fence are people kind of not necessarily ironically listening to what's actually being said from a complaint point of view.
Makes complete sense. Yes. Yeah.
And so when you say you're certified in tinnitus treatment, tell me a little bit about that certification. What does it entail and what have you done to get that treatment?
It's through the American Board of Audiology. So I'm board certified as well. And it was 2-part module in 2018, I believe is when I completed it. But it basically goes into all different treatment options for tinnitus, because while there's no cure for tinnitus, there's different options and there's different research. There's no golden standard for it. So we kind of went through all the possible treatments, whether it's cognitive behavioral therapy, hearing aids, sound maskers, anything and everything. And so that really helped me incorporate into my practice, a more holistic approach on how to treat someone with tinnitus. And having it myself, I understand that, there's no one reason for it to be better than one treatment better than the other. It's patient specific.
And so how long have you had tinnitus?
So I've had tinnitus
as a percussionist.
Percussion. Yep. I've had it, I want to say since about 2009 is when I knew about it, but it didn't really start hitting me until grad school. I got a lot of stress in grad school is stressful. And so it would be so loud in my head that I'd be looking at the words on the paper, trying to read them. Couldn't process what I was reading because it was just so loud and obnoxious. So I can completely understand how it affects the quality of life and function of daily life if it's not understood. I think education is the biggest factor in tinnitus, and then figuring out how to manage it person to person.
And so when you say that education is the biggest factor, give us an example, like when you talk to somebody about tinnitus, what are the types of things you tell them or you talk about?
Yeah, it's a fight or flight response from our limbic system. That's where the spectrum of tinnitus can be. Oh yeah, I live with it. There's no problem versus, oh my gosh, it's so severe, where I've seen patients that are suicidal. And so trying to educate them on they're not going crazy, they're not going deaf, and that while it is extremely loud, we have to try and figure out how it started, why it started, because if we can kind of pinpoint that, we can hopefully give peace of mind to why the brain changed and started creating this sound. And our brain is amazing at rechanging itself with neuroplasticity. So I always talk about that as well. Tinnitus typically isn't something where, everyone wants a pill to pop it and just be done with it. But it takes a long time to retrain the brain to reduce it.
And so with your patients and your experience, do you find, there are, obviously people have a motor vehicle accidents, airbags deploy. I mean, those types of things. But more often than not, I don't find an inciting event. Do you with your patients? Or
I have, and it's typically a stressor. So it's usually a stressful event that happened on or around the time that the tinnitus started. So as of late, I've had several patients come in and having it for years. And when we kind of break down, I'm like, did anything happen around 10 years ago when this happened, when it started? Did you just wake up with it? Can you think of anything? And after getting into it, we found out with one of my patients, he had a few deaths in the family back to back, not prior, but because, your mind's so focused on this stress, you don't realize that all of a sudden here's this noise in our head. So kind of piecing those things together sometimes is helpful. And sometimes it's just hearing loss or medication or noise exposure like myself.
or all of them.
Or all of them. Yeah.
Right.
For sure.
Hearing loss with stress plus medications plus noise exposure.
Way worse. Yep.
And so when you, what would be a typical treatment regimen in terms of, starting at the beginning and then gradually progressing through the treatment regimen for the tinnitus?
Yeah, it's a great question. It's again, no golden standard for me. So
not on a prescriptive basis, just on a descriptive basis. How's
descriptive,
that?
Sure. So typically it's how severe it is for the patient. I always have them do some form of questionnaire, typically the Tinnitus Functional Index, the TFI. And depending on if hearing loss is involved, we kind of rule in or out which therapy options will be best for them, whether it be hearing aids, whether it be a device that they wear at night to sleep and try and retrain the brain, therapy with a psychologist, or if it's beyond my ability to help them with the any mental matters going on. So things like that. And then the follow-up care it's more frequent in the beginning with my tinnitus patients until we kind of get them on a roll and they're feeling better and we see that TFI score reducing. And then
I find there's often a comorbidity of either sleep deprivation, depression, or anxiety, and they're
for sure
really tough to tackle. So I hopefully, or obviously, you have somebody who will work along with you in these types of patients.
I do. I actually just found someone fantastic in the area. We spoke yesterday, and I'm super excited to share it with a few of my patients. So looking forward.
No, that's great. And so, and then obviously the other place you're in is the hearing loss space. And how is that going? And how's that going in your practice in terms of what's your approach to patients with hearing loss?
I love educating. I love telling people probably more than they want to hear. And I always preface with that. And so I like to explain what they're getting into because our industry is so confusing. So you see these ads in the newspaper and there are 2 huge pages, and then you see $500 hearing aids, $8,000 hearing aids, and it's just confusing. So a lot of my talk with my hearing loss patients is the differences between what they're seeing in a newspaper ad or online and how to be wary with what they're researching, and kind of talking about the specifics of their goals, their hearing loss, how long it's been going on, where it affects them, to try and really figure out the most appropriate process for them, which device, which model would be best based on their concerns. But I definitely educate a lot on pricing. We go with the bundling and the unbundling and third parties and all that. So I'm a big advocate for just being open and honest about our field.
Sure. And how do you navigate all of that? Third party versus insurance versus private pay? How are you?
Yeah, I tell my patients, we always check everything to see what's going to be best for them, because I'm more of an unbundled practice. So a lot of times my pricing is less than what insurance cover or their third party would, because there's a middleman involved a lot of the times. So they understand that, when there's a middleman involved, it can take more time. It can, they need authorizations. It may be a little more costly. Some people have great benefits and I can't compete with it. So we go that route, but it's more so, them understanding it's not just, like your glasses, you're creating a relationship with this provider for the long term, because hearing aids need to be adjusted. They need to be taken care of and maintained. I usually say every 6 months. So you're creating that relationship and it's long term. You want to make sure it's appropriate.
So that's great. And so I was intrigued when we were first talking that, you said you're doing veterinarian audiology, right? So as a first thing, how did you, for the listeners, that is not a standard component of typical audiology training. So
not at all.
you are likely not to go in and talk to your audiologists say how much veterinary training, they're going to say none, unless they did research, right? And used
right.
But so tell me a little about that aspect. And actually, it's interesting because you were saying you're starting to grow that part of your practice. So how did you get into that, and what training did you get?
Yeah, it's a certification in animal audiology. It's not super new, but it kind of is to our field. I believe there's only 2 universities offering the training right now. I went to University of Greeley in Northern Colorado. So most of it was an online remote program, but I did go out there to do hands-on practicing and to do my practicums. So it's really neat. We use auditory brainstem response. They say Bayer testing, brainstem auditory evoked responses, but it's the ABR is the same thing we do with the newborns or anyone we can't test subjectively, or we need something objective for retrocochlear pathology. But
real quick, I'm sorry for the listeners. What we're saying is it's non-participative audiology, meaning you don't push a button, you don't have to say you heard something. Obviously, if you're testing an animal, they can't do that. And so we're doing what we would call passive audiology, where the test subject doesn't have to respond. We can measure the response absent a physical response from the animal. So just to go ahead, I'm sorry.
No, thank you for the clarification, Mark. Right. So we put inserts in their ears, but we are recording brainwave activity. So we put electrodes on the scalp and by the ears, and we can determine based on the peaks in the brainwave responses, are they hearing from it? And we can even determine thresholds. So we can be as simple as a screening, do they have hearing loss or not, or find diagnostics of where their hearing loss is and at what frequencies. We can do otoacoustic emission testing. It's another a test where we play tones in the ear echoes back a response. And so the patient or client is not doing anything but sitting there. So right now it's really awesome for, a lot of AKC certifications or canine requirements, especially with breeders. They need to have the puppies hearing tested to make sure that they're hearing, because there's several breeds. I believe there's 11 on the list where there's higher risk for single-sided deafness or bilateral deafness. And I absolutely love dogs. So I kind of just found something popped up. I love researching, and I learned I clicked something on animal audiology, which is where it brought me to Dr. Pete, who kind of started this training. And then I was like, I've got to get into this. So I love dogs. If I could test dogs all day, I'd be in heaven. And then I've never really been around horses, and they're beautiful animals. So testing their hearing is really fun too. So I found a veterinarian local that I'm working with. We're setting up the process. I've got all the equipment. I've got it calibrated on some pups already. So just getting set up to rock and roll.
I assume the subjects have to be asleep.
No, they don't have to be asleep, surprisingly. They just need to be pretty still, not moving too much, which is not too difficult to do with most dogs. In the case that we need to sedate them, the vet on staff would be able to assist me with that. But typically, we kind of prep the dogs for just relaxing them if the owner needs to hold them or.
Wow. So it seems like, the puppies I've been around don't hold still much, but I guess they nap just like children, right? So just like
they nap, or if you kind of hold them, we have ways you can kind of brace them. We've learned there's a lot of bracing techniques to kind of just keep them from moving as much, because less movement means less artifact, which means quicker testing.
Right. And so how long does it take to test a dog? Only a couple of minutes, correct?
If it's a screening, it could be a couple minutes, diagnostics, and then how the pup is tolerating everything. It could take up 45 minutes. That's the longest mine's been.
Okay. That's fascinating. I mean, and even the horses are awake too?
Yep. The horses are awake. We go by the owner because horses and owners have this really unique relationship. So when the owner tells us we're ready to rock and roll, then we start putting inserts in their ears. There's a lot of muscles in a horse's ear. So we have to use some, it's kind of like tape, to help wrap. And these inserts are huge to get into the horse's ears.
Well, because they can move their ears, right?
Exactly. So they can pop out. Yeah, I'll have to send you a photo of what it looks like when we tested them, because they're wrapped up with some tape and these wires, but it doesn't hurt them at all. They're standing there, and everyone's awake for it.
Yeah, it seemed like you could use, the racehorses have blinders, right? Because they want them to look forward. So it seems like those type of head, they're basically hoods, I think, with blinders. So it seems like you could maybe do something like that, but I don't know. I'm sure it's challenging, but interesting.
Yeah, for the most part, every horse that I've worked with, and there's been at least a dozen, it's been a non-issue. The most energetic one was a little pony. So it was just hard setting the inserts in his ears and getting the tape wrapped up. But once that happened, it was pretty easy.
And so is the hearing status for horses a breeding issue as well?
It can be in some, for sure. On that aspect, it's not as researched as the canines, but they're trying to even research more on dolphins and do all this testing with other animals too.
Well, it'd be interesting. Not that you want it, but you wonder if hearing loss would actually be a competitive advantage to a thoroughbred, right? I mean,
right.
Lack of distraction.
Lack of a distraction. That's got it. My thoughts exactly. Now, it's interesting. So it's really in the diagnostic evaluation stages. The universities are in the research of doing hearing aids or whatever it may be, and if it's beneficial or not for the animal.
Well, I would love to see a picture of you testing, and then when you put in the first horse hearing aid, I want to see how big that thing is, and how you get that.
I cannot imagine how much impression material.
How you get that to stay in, right?
Yeah.
So, I'm not sure there's going to be a loss and damage waiver for that particular hearing aid.
Right.
Right. And so in terms of your practice, where do you see it going over the next 5 to 10 years? I mean, what are your goals or what's your vision for the future?
Yeah, I basically started it from the ground up, like been by myself, and I've had some patients to start with, but I've do all the work. So my goals are to add on more people like myself that are motivated, talented, passionate audiologists, or even a dispenser, because, I've seen both good and bad dispensers. I've seen both good and bad audiologists. So I think it's about the training and the education. So I can, I think I'll probably have 1 or 2 more offices, just this feeling, but my goal is to just be able to have more providers like myself to educate our community and get appropriate hearing health care out there.
That's great.
I want to do more education and talks. I've been doing a lot of speeches and seminars. I love that. So hoping to do that more too.
That's wonderful. And so Kelly, what's your favorite sound?
My favorite sound would have to probably be my son's voice. Yeah, he's almost 3.5 and he's my little ham. So that's got to be my favorite sound.
That's great. And your second favorite is percussion instrument, I assume?
I would say some form of percussion instrument. Marimba was my forte. I loved playing marimba, so I can't wait to get back into that.
Oh, that's wonderful. And so if people want to get a hold of you, Kelly, how would they get a hold of you?
Absolutely. So I'm on Instagram and Facebook at Doc Side Audiology. It's DOC Side Audiology. That's the same tag for Facebook. And then you can also, if wanted to email me, it's DRKELLY, Dr. Kelly at docsideaud.com. So
what, just out of curiosity, what is the derivation of that as compared to Hearing Aids of Sarasota?
Yeah, so my business name is Doc Side Audiology. Yeah. And I wanted to have a little play on words with it. But the practice that I took over is Hearing Aids of Sarasota. So this one location is doing business as that. But as I'm expanding and I'm not in Sarasota, it makes sense to keep that name. So I'm using my actual business name.
Doc Side Audiology.
Doc Side Audiology.
So the umbrella organization is Doc Side Audiology, and your main office is currently called Hearing Aids of Sarasota.
You got it.
All right. That's great. Well, this has been great. I really admire your passion, and certainly you're really going all at it in various spaces. And I think that's great. And so I really appreciate you for coming on to the podcast. And this has been a great discussion about a bunch of various topics. I learned a lot today. Thanks for coming on.
Thank you so much for having me, Mark. I appreciate it. And I love, like I said, educating.
That's great. Have a great day.
You too.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.